Yeah, Al Bloomstein.
But both Mr. Gross and Mr. Feldman mentioned issues of drugs and drug markets. To what extent are you suggesting that it's drugs that reduce inhibition on using the gun? To what extent are you suggesting that it's the violence within drug markets that are the cause of firearm violence? What are the issues beneath the drugs reference?
My reference is very similar to our first prohibition. We know from our history that whatever the upsides were to alcohol prohibition, the unintended consequences were far worse to this country. Indeed, our first national gun law, the 1934 Firearms Act, was a direct result of the St. Valentine's Day Massacre. I'm not suggesting that the problem is between amongst drug dealers and drug users, but rather that the problem primarily from narcotics officers that I've spoken to extensively, including LEAP, Law Enforcement Against Prohibition, is that the 35 to 50% of gun violence in our cities, in their communities, is directly related to control over the illegal black market in drugs. So it's between drug sellers, not users.
Is that an argument for legalization of drugs?
All I'm prepared to say here is that this needs to be part of our discussion and to look at it. And to avoid discussing it does a disservice to this issue and to our country.
Yeah.
But highlighting some of the involvement in the markets themselves as an issue of violence,
Well,
gun violence.
if one follows that to its conclusion, and if you were to suggest, and I'm not prepared to do that at the moment, but if you were to suggest that drugs in this country were legalized, if those figures are correct, why shouldn't we expect the same results from that that occurred after we re-legalized alcohol, eliminating the violence that goes along with the illegal market? And if those figures are anywhere close to correct, that's an awful lot of gun violence that could be prevented in this country. One has to weigh intelligently between and amongst competing risks. That's my suggestion, and I believe that's what the Vice President was answering, that yes, it's time to have that conversation.
Mr. Gross, was that your reference?
Absolutely not. First of all, part of my reference was about, yeah, I did. Oh, sorry. Part of my reference was about the irony of examining the role of the prohibition of drugs and being so focused on that and not focusing at all on the role of guns. The other part of my reference to drugs is around the opportunity that might exist in examining the role that drug use plays in identifying people who are at risk of harming themselves or others, and what we might be able to do to keep guns out of their hands.
Inhibiting effect of being high on drugs.
Disinhibiting, maybe correlations with other disorders, but there seems to be a correlation, and if that is a category of people who we can, where we can diminish their risk to themselves or others by keeping guns out of their hands, that's something worth examining. I'm not jumping to that conclusion necessarily, but I certainly think it's worth examining.
Okay. Who else on the committee? So, yes, please, Lou.
Mr. Gross, one of your slides talked about irresponsible gun owners and bringing cases against them. Were you referring to strictly criminal cases, or do you think that, are you recommending that civil alternatives be pursued against irresponsible gun owners as well?
Yeah, I don't know if I'm prepared to answer that. I'd rather have have one of the part of our legal team here. I do think anything that can demonstrate the fact that it is a small minority of irresponsible or prohibited people that are ruining it for the overwhelming majority of gun owners out there that are law-abiding, that do have positive intent, is a positive step. In terms of the exact legal strategy, I'd rather let part of our legal team comment on that.
Oh, go ahead.
Then I have a similar question for Mr. Frazer. Mr. Frazer, you're aware, of course, you're an attorney, so I think this is a field you can answer. But you and I are both hunter safety instructors, something we have in common based on your resume. And we teach our students that when you pick up a firearm, you pick up responsibility. Now, the studies that you're proposing are all based on survey data. Do you have any recommendations on survey methods or ways that we can get more accurate information? Because I think people are reluctant to speak about firearm ownership in surveys. And that's a very difficult challenge in researching this issue if we're relying on what people ask, or tell us on a telephone. Do you have any recommendations on solid data that might be available to do this research, to help us prioritize research?
That's an excellent question, and it gets into something that I thought about putting in my slides, but I would have been over the limit. And Professor Cook fortunately touched on it as well, which is the problem of survey research. Studying gun ownership and gun policy is a challenging issue because you don't have data available that's collected in any mandatory fashion. And so you have to rely on survey research. But we have this well-recognized problem in the field in which people won't answer at all or will not answer truthfully or completely because of the sensitivity of the issue. They have concerns about their privacy. They have concerns about personal security. People may have legal concerns. For example, if they are a resident of a high crime area who own residents of high crime areas may own firearms for self-protection with no criminal intent, but in violation of local law, for example. They may be reluctant to admit that to a researcher, and that's also been well documented in the field of defense, or well discussed anyway, in the field of defensive gun uses. But I do think Professor Cook's suggestion was a good one. Some preliminary research on how to best conduct research that overcomes those issues of trust. So, for example, one area that we see is just figuring out how many people own guns is challenging because the self-reported rate of gun ownership rises and falls and appears to be correlated over time with how controversial the issue is at the moment. So if the public debate about gun control isn't very heated, people are more likely to report gun ownership. And then if you look at numbers, for example, in the mid-90s when it was front and center in the public eye, and under the Clinton administration, self-reported gun ownership rates went down. The guns weren't disappearing, but the response rates were probably changing, and some further analysis of that beyond what's been done in the past, I think, would be extremely helpful.
Okay, Gary Kleck, please.
I have two questions for Phil Cook. You prioritize 3 or 4 topics for future research, and one of them is to suggest we look at state laws on private background checks, and I think that's a perfectly reasonable suggestion, but my question would be, would you really want to focus on that in particular, one at a time? Given what you said about California's laws, it was passed at the same time that other gun laws and other criminal laws were passed. Wouldn't you really have to simultaneously assess the impact of all gun control laws, one of which would be requiring background checks on private transfers, so that you could separate the effects of one type of gun control from another?
So my suggestion would be that the CDC take a careful look at any proposals that they received on this to see about feasibility and to see whether and fact, the proposed design would be potentially successful in isolating the effect of universal background checks or at least background checks governing private transfers. Um, I, it just seemed to me that the private transfers in particular had risen to the top, given the debate we've had over the last 3 months, 4 months, and that it was particularly outrageous that we didn't have anything to say about it. It easily could be that in the course of doing the evaluation of that, you would, and certainly it would be true, that you would have to take into account any other legal changes that were going on in those same states at the same time. But as a matter of focus, I think there's some justification in looking at background checks.
Thank you. My second question was, given that you prioritize 3 or 4 topics, why the priority on school rampage shootings, given that they must account for less than 0.1% of gun deaths?
My concern about the school rampage shootings is that during the 1990s, and especially the late 1990s, of course, it was an enormously compelling and worrisome feature of the landscape, just like other rampage shootings have been since then, far out of proportion to the number of people who actually die. And you could say that the public is misguided, that they should have a more balanced perspective on school safety. But I'm inclined to take the public concern in this area as a good measure of its importance as a research topic. And the parents really do have a special concern about the safety of their children when they go to school. And that combined with my concern that we might well see a new epidemic in this area. It's very hard to predict epidemics, as the epidemiologists know here. Wouldn't it be nice if this time we were ahead of the curve instead of organizing NRC committees after the fact, like we did last time, or having the Secret Service say, let's look at what happened? I think there's a possibility of doing some very interesting work. I know the National Science Foundation is considering this possibility, and it seems like the CDC could also.
So I'm going to just suggest that a methodologic thing to our committee. If you want to be put on the speaker list, if you would turn your name card up, that would be very helpful to me. I'm going to take the liberty to ask a question myself. So we've spoken about background checks repeatedly, and there are background checks and background checks. And so a question I would have is there a research question around what kind of background checks, what criteria ought to be used as a part of a background check, or are these going into way too much detail as an initial step? But everybody assumes that there's some common norm for what constitutes the right or the wrong or the useful or the not useful background check. Does anybody want to comment on that?
I'd be happy to. Dr. Cook, did you want to first, or?
Yeah, sure.
Yeah, sure. Oh, okay. I think it's a very worthwhile discussion, particularly in the area of how we define prohibited purchasers. I think there's certain people that we all agree should not be able to buy, own, or carry guns. And I feel like we can also say with confidence, but not with enough data, how often those people are purchasing guns without background checks. So I think that's the biggest that's the biggest area of focus. But I think looking at it more finely, how we define prohibited purchasers, where we draw those lines, particularly in the area of mental health. There is a somewhat kind of antiquated definition of dangerously mentally ill that we currently apply to the standards of background checks. Institutionalized, these days, a lot of treatment for mental illness is outpatient. I think we also have a lot of more information in terms of which mental illnesses really create a predisposition toward harming oneself or others, and very importantly, which ones don't. And as a result, you always hear a conversation about stigmatization after one of these high-profile tragedies. So I think a conversation about where to draw the lines in terms of prohibited purchasers as it relates to mental health is an important one, but not at the expense of talking about what we can do to make all purchasers of guns go through reasonable background checks.
Okay. So I have Dr. Cook, you were going to say something, and
Yeah, actually,
then Mr. Feldman.
Yeah, I was also going to mention mental health is an area where there, of course, is a very lively conversation going on right now with a number of experts. Kind of general dissatisfaction with how that is defined currently as being both over-inclusive and under-inclusive, but in any case, not well targeted. So that seems like an area by all means, if that's part of the CDC purview, that it would be an important area. I'd also say it's not just the list of disqualifications that are in the Gun Control Act as amended, but also the question about what the effective disqualification is given our data systems. And so that, of course, we have pretty good records on felony conviction and on fugitives from justice and some of the other areas, but generally very poor data right now on those who are currently disqualified due to mental illness or disqualified due to drug abuse and drug addiction as two areas which are mentioned in the law but are effectively not enforced.
Okay, Mr. Feldman?
Yes, the current law prohibits convicted felons and those with domestic misdemeanor convictions against them. It's a very arbitrary distinction. When you ask the question to the American people, do you believe that violent predatory criminals and dangerous mentally disturbed individuals ought not obtain guns? The answer is overwhelmingly yes. In fact, I've never heard anyone who said, gee, it's a good idea, they should be able to buy lawful guns. So let's compare and contrast sometimes. What is a felony in Virginia is a misdemeanor in Maryland. Why should we, frankly, be concerned that someone convicted of a very serious nonviolent crime, tax evasion, loses their Second Amendment rights, and yet someone like a Patrick Purdy, the shooter in Stockton, California, who had been arrested for 22 violent felonies, plea bargained all of them successfully to misdemeanors, was allowed to lawfully purchase in California all the guns which he in fact used that day in Stockton. We have a system that the data is only as good as the data we put in. Why do we draw this artificial distinction between felonies and misdemeanors when that's not really the heart of the issue? Furthermore, let's also recognize that no matter what we think and suggest, those 500,000 gun thefts are not going to be putting themselves through background checks. I go back to this issue time and time again. 500,000 stolen guns. Whatever we do on the one hand that's useful, intelligent, rational, what difference is it going to make if we have this gapping hole on the other side that makes all our good efforts here, frankly, irrelevant and shifts the problem?
So luckily, it's not our job to make those judgments about policies, but rather to ask the research question that might inform the policy. Dr. Bloomstein.
This is a question for Mr. Hotle. In your discussion about suicide, most of the cases you raised were those folks who had some emotional trauma. What about the people who are terminally ill in some way and would like to cut that short? Can you say something about, in Wyoming at least, what fraction of folks are in that circumstance as opposed to the kinds you referred to?
Thank you. Well, I can't give you data on that. I can tell you from doing this for almost a decade that that number is going to be relatively small. compared to the overall number of people who take their life for some other reason than perhaps they're in a terminal illness and in a great deal of pain and so on. That really is a policy issue about euthanasia, and I don't know that it's something that can be answered through this debate. And I guess the question is, for those of us who deal with folks that are mentally ill, is that there is a continuum. And so it's somewhat of a slippery slope to say, well, at what point are you sick enough or in enough pain that we as a society will say, well, we collectively condone euthanasia or taking your own life with a firearm or not. But I would say, from looking at the numbers in our state, that number would be very, very low.
Can I please just respond to that as well? I think in addition to the audience that we were just talking about, there are two other audiences that are very important and that have been discussed today. There are two other audiences that are very important to consider as it relates to suicide, both in terms of the rate of suicide as well as the opportunity for intervention. One is youth, adolescents, high rates, but also, and as the parent of a daughter who's approaching adolescence, I can also testify to, show me one that isn't sometimes a little mentally ill, but also, for the opportunity to intervene through parents and clinicians talking with parents. And then the other one is returning veterans, where there are high rates of suicide, and also opportunity to intervene through parents, through spouses, because what we do is we look for the opportunities to intervene around access to firearms among people who are at high risk of suicide, harming themselves or others, without necessarily needing to change the attitude or behavior of the person who is at risk. And both youth and returning veterans represent that opportunity.
Okay, John Rich, please.
So my question relates to suicide as well for Mr. Hotle, and particularly you mentioned, and it gets to the discussion we just had, but you mentioned middle-aged men as high risk. We've talked about youth. Are there particular communities where there's a high risk of suicide, Native communities, for example, LGBT communities for which there's research needed to better understand either communication strategies or the relationship between distress and use of firearms for suicide?
Yes, I would wholeheartedly agree, because I think the messaging that you're going to give to the GLBTQ youth who may be suicidal is going to be very different than to our Native American population here. And so and one of the subpoints of our recommendation is, it's going to take the development of multiple communication strategies, I think, to resonate within not only those communities of folks that are at risk, but also the influencers or the family members of those folks. So you're right, it is not a one kind of message fits all.
Okay, Steve Hargarten.
Thank you. In Milwaukee, we recently have had two firearm-related rampages that were essentially murder-suicides. And we recognize that many of the school-based rampages that you referred to, Dr. Cook, have been murder-suicides. To question to both you and to Mr. Hotle about unifying research recommendations, are there some opportunities here to look at research priorities that get to those at-risk youth, get to those at-risk individuals, be they older males who in domestic violence situations not only kill the intimate partner but themselves, perhaps children? Are there some unifying research priorities that we can be recommending and thinking about that help us get closer to preventing those events from occurring?
I mean, that sounds promising. I think there are unique features to the school rampages that have to do with the school as a stage, as kind of a theater on which the kid is playing out some fantasy that probably in most cases does have to do with mental illness or the incipient mental illness that is going on. But the importance of that I wanted to emphasize is simply that it is often broadcast in advance, that the classmates know about it. It's on the social media and so forth. I don't think that you would necessarily see that for the older people that where there's a murder suicide or several murders and a suicide. But in other dimensions, there may well be some possibility of a continuum.
Yeah, and I would agree with that. I mean, when we talk about murder-suicide, the suicide part, particularly in the high-profile cases, often gets ignored. I would think there could be research about upstream kinds of strategies for prevention and intervention that would lessen the risk, particularly among young people, for those kinds of violent behaviors, whether to oneself or to oneself and third parties.
Thank you. Paul?
My question is for Mr. Hotle, and I was interested in your comment relative to changing the social norms related to protection of those at risk of suicide. And you described creating a norm similar to the sober driver. And I'm wondering if you have good examples of intervention strategies that have shown promise, and in particular, is there additional work that needs to be done to demonstrate the effectiveness of these kinds of analogous protective factors?
Yeah, I think that's precisely correct. And that comment about the designated driver was really in the context of how do we normalize the conversation around when you have a suicidal person that's in crisis that has easy access to firearms, how do we make it normative behavior for those people around them to engage in protective activities that may only last the duration of the crisis? So for example, storing the weapons off-site with the law enforcement agency, or I know an individual that is actually very active in suicide prevention, but is also bipolar. And what happens when he begins to feel himself spiraling down, he gives his wife the keys to the gun cabinet. But it's this kind of normative behavior around suicide in general. It is, look, you're going through a crisis. It's no different than if you were having some kind of a heart problem. We want to make sure that we protect you and do whatever is necessary during the crisis. And then things can return to the status quo after that person gets the help that they need. So that was my analogy of this counseling access to lethal means kind of intervention to designating a driver. And I know that Harvard has done quite a bit of research on this. There is an online course or training that folks can take to learn how to talk to their patients about safe storage or safe use of firearms during periods of crisis. So there are interventions out there, but I think in terms of the effectiveness of those interventions on particular populations isn't as good as it could be.
Completely agree about the importance and opportunity around changing those social norms, and it's a big part of certainly what I've spent the last 15 years of my life focused on with the Center to Prevent Youth Violence. And I would offer into the conversation a program that CPYV has developed called Suicide Proof Your Home. Yes, it's important, vitally important to educate and really, in essence, change social norms among clinicians to have the conversations with their patients. But it's also important there's also a big opportunity to go directly to parents as it relates to youth suicide, and that's the idea around Suicide Proof Your Home. It was implemented in Rhode Island through the Rhode Island State Department of Health. It wasn't a scientific study by any means in terms of the evaluation, but it did show some promise and evidence of success, both in terms of awareness and changing attitudes about the risk of guns in the home as it relates to suicide. It's now being expanded to Nevada. That idea of removing guns temporarily has proven to be a very important one. And in Nevada, it actually seems like it's going to be a partnership with the schools in terms of storing guns, storing guns there. So I just want to offer that as a potential intervention.
So I'm going to take the liberty of the last question. Dr. Hotle, you started out with an assertion or a statement that if there are no guns, the potential suiciding person doesn't shift to another means. Is there a substantial database to support that comment, or is that the kind of a research question that needs to be posed?
Well, I think there is some research that's been done on that. And my understanding of the research that's been done is that there is a percentage of people who will displace to a less lethal kind of means. But there is a significant percentage, and this may be fruit for greater research about what that percentage is, that will not go on to attempt suicide during that crisis, and then may never go on to attempt after that, because oftentimes when you get through the initial crisis, there is no reattempt rate after the person gets help. So I think there is more research that needs to be done there, because I think it is one of the most prevailing myths in suicide prevention is that, well, it doesn't matter if we take away any kind of means, because they will just go on to something else. And I think the research that's been done shows that's not true, but we don't have solid data about, what is the displacement rate.
Okay, I'm going to bring this session to a close. I want to very much thank the panel for an extremely useful set of presentations and an extremely useful discussion. I'll just remind everybody, as we are thinking about the kinds of research questions that need to be answered, it's easy at times to drift over into policy statements. That is not our issue. We are the science folks. So I thank you for that, and I hope as we go forward in our conversations, we'll continue recalling that. So we're going to take a break. It is now 21 minutes to 11. We will reconvene at 10 minutes to 11 promptly. Dr. Hargarten is quite a taskmaster, so he will start exactly on time and rule with a strong hand. All right. Thank you all. See you in 11 minutes.
Thank you.